Can gut health prevent common infections in sickle cell? Imagine your gut as a busy city full of tiny residents working together to keep you healthy. In people with sickle cell disease, or SCD, this city's health can influence how well your immune system fights off infections. But does a healthy gut alone stop common infections? Not quite. While a balanced gut microbiome can support your immune defenses and reduce inflammation, it's just one piece of a much larger puzzle. People with sickle cell disease often have a weakened immune system, partly because their spleen doesn't work as well. This makes them more vulnerable to infections like pneumonia or meningitis, which can trigger sickle cell crises or serious health problems. The community of bacteria and other microorganisms in your intestines, called the gut microbiome, plays a key role in your overall immunity. When this community is out of balance, a condition known as dysbiosis, it can lead to increased inflammation and a higher risk of infections. Research shows that certain good bacteria, such as Akkermansia muciniphila and Roseburia species, help keep the gut lining strong and reduce inflammation. These bacteria produce substances called short-chain fatty acids, like butyrate, which support gut health and help keep harmful toxins from entering your bloodstream. Improving gut health through a healthy diet, probiotics, or other therapies might help reduce some complications of sickle cell disease, like chronic pain and inflammation, which could also lower infection risks. But these ideas are still being studied, and scientists are working to understand how best to use them in treatment. The integrity of your gut barrier is especially important. When it becomes leaky, or leaky gut, bacteria and toxins can slip into your blood, causing more inflammation and raising infection risk. People with sickle cell disease often experience damage to their gut lining from repeated crises, inflammation, and frequent use of antibiotics. This damage can worsen gut imbalance and make infections more likely. Preventing infections in sickle cell disease mainly relies on proven strategies. These include getting all recommended vaccines to protect against common bacteria and viruses, especially in children. Doctors often prescribe preventive antibiotics for young children to lower the chance of serious bacterial infections. Good hygiene, like regular hand washing, is essential. If you do get sick, prompt treatment is crucial to prevent complications. Staying well hydrated and eating nutritious foods also support your immune system. While focusing on gut health by eating plenty of fruits, vegetables, and foods rich in minerals and antioxidants can help your immune system, it should never replace these proven methods. Instead, think of gut health as a helpful addition to your overall infection prevention plan. In summary, maintaining good gut health might help your immune system work better and reduce inflammation, which can be beneficial for people with sickle cell disease. But it cannot fully prevent common infections on its own. Current best practices include vaccinations, antibiotics when needed, good hygiene, and prompt medical care. As research continues, new therapies targeting the gut microbiome may offer additional support, but always follow your healthcare provider's advice and stay informed about safe, proven ways to protect your health.